partner with the county to do a study on the 371 210 intersection to look at future improvements that can be done there, so that it can be utilized to secure additional funds to take it beyond just an initial study going forward. SEH was the consulting firm that the county contracted with to complete the study. About a month ago, they finalized that, and Tim Bray, county engineer, is here in attendance to present the findings of that study to the council. So with that, I'll turn it over to Tim.
Thank you, Brad. Mr. Mayor and Council, thanks for having me. As Brad mentioned, I was here in February asking all of you to see if you wanted to partner with Crow Wing County and MnDOT, actually, to embark on a study to raise some awareness and gather some information so we can, almost a grassroots effort to get this intersection in MnDOT sites. And it's been in place for about 20 years. I believe the bypass was done around 2000 or something like that. And this intersection has continually increased in volumes and crashes and those kind of things. And I think last winter, when there was talk and eventually the Congress did pass a large infrastructure bill, I got to thinking that, we're not ready. We have this project right here. We're kind of been floundering with it. MnDOT's it's not been high in their priority. They're focused on other priorities, that we just aren't ready to compete for all this money. And about as soon as we started to talk about this, all of these announcements started coming in for all these grants, and we're just not situated. MnDOT's not situated to do much with this. So Brad and I got to talking about this effort to raise awareness, kind of figure out the challenges. Is there a feasible alternative? And that's what I want to try to go through today. I was at the county board this meeting. It took 45 minutes, and I'm not going to take 45 minutes. I'm going to try to stay a little bit high level, but certainly answer any questions that I can about it. So as you know, right here, it's right here in Baxter. The volumes out there are 31,000 for 371 and 24,000 for 210. So that's a very busy intersection, and it's actually one of the busiest in the state. Trunk highways coming together with those volumes is not unheard of course, but up here in the north part it is quite voluminous. So we found out through the study that it ranks 14th highest for crash costs in the state. That means there's a number assigned to every kind of crash, even a fatality crash, they assign a number to it. And if you compile all the crashes, and I guess I have it, it's like over the last 10 years, it's almost 500. And so if you add up all those crashes, it's the 14th most costly in Minnesota. The number of crashes there also are 3 times the critical rate, and the critical rate is actually, it's a pretty complex formula, but if you think about the average of intersections that are kind of like that, 2 4-lane roads that come together, you can find some that are similar around the state, and compared to those, this one has 3 times the crashes as something that's similar out there. That also signals the problem. If it gets just over the average, it starts to signal problems. So we're 3 times that. It's definitely on the radar screen, or should be on the radar screen. And as I mentioned, MnDOT doesn't seem to be prioritizing it. They're really focusing on other priorities. To me, there's a study on this side of the interchange or the intersection, and a study on that side of the interchange or the intersection, but it's not in the middle. And so, as I mentioned, we're trying to raise awareness so we can get the money, raise that awareness, and get MnDOT working on it. One of the biggest, the elephant in the room is the at-grade railroad. I'm kind of preaching to the choir. And so some of the opportunities that we had SCH look at involve grade separated, so interchanges. And then also we did look at some at-grade intersections too, so the railroad would still be there. And I think we can all recognize that bunch of money there and still have the railroad impacting the intersection. And then we did, this other one is, this is on our one pager, is complex mix of traffic. We have a lot of guests here, we have a lot of locals here. Familiarity is one thing that can lead to increasing crashes, people not expecting or knowing what they're coming upon. And the other one, we all know too, this is the primary hub, so we've got people coming from all over. It's busy all the time. There's almost no slow time for this intersection. So one of the first things I want to say is that these are just concepts. And it'd be easy for those who may read about this in the paper to kind of gravitate towards these nice pictures that they develop for us as that's the concept, we're going forward, we're moving into design and that kind of stuff. That is not the case. The intent behind this whole thing was to identify what the challenges were and almost identify a few feasible options. So those who had maybe said, hey, threw their hands up in the air, it's like, we'll never figure this out. We can show them that there is something out there. It's not fully developed, and we have a lot more work to do. And we're hoping with this effort, we can get the next couple $1 million to actually dive in deep, or pardon me, have MnDOT dive in deep, not us. We're just getting the ball rolling down the hill. We need somebody else to take it, to start to take it to the next level where you get into the environmental documentation, you start to engage your public and your business community and find out all those impacts that it may cause. It's much more than just simply plopping, a new intersection in there. So one of the things we set out to do was kind of look at some options, and really the principles we used, there's 4, 5, 6 of them. It's really we're looking to find a set of options ranging relatively low cost. Interchanges are ridiculously expensive, but trying to find something that's reasonable. We want to investigate the at-grade options, so the way it is right now, no bridges or anything like that. Provide options for grade separated, and I'll go over those. These are with the bridges going over the railroad and over 210 and 371. There's a couple different options. Certainly paying attention to the business owners and the impacts that they're concerned about that could come from this. We wanted to make sure that we limit the closures or impacts to those types of access points. And then certainly provide accommodations for pedestrians and bicyclists. We took a high level look at that. And then also, we really wanted to only advance, or maybe that's a too strong a word, label something as feasible, that it just practical. We could spend a whole lot of money there going way over, up and over under the roads. And a few of those options just aren't feasible. And so we did not look at those much. So the at-grade concepts, I won't go into them too deep, but when we looked at them, it was determined that if we left it the way it was and did nothing, it eventually would have to function under the increased traffic that we can expect. It'd have to be a 6-lane at some point. It'd have to be 3 lanes in each direction. It's kind of hard to imagine that up here in northern Minnesota, but that's what the traffic analysis showed. I also was really adamant about investigating a roundabout. And so back in February, we talked, I came here, it was reported in the paper and chatter around town, social media and stuff like that. I was like, okay, here's another roundabout. Well, I can tell you, I wanted to put that to bed. That will not work here. They do not work everywhere, and this is certainly a place where it will not work. The analysis was, if you had to have one there, it'd be a 3-lane roundabout. Imagine that. I don't think there even one exists, but people are find it challenging to do two lanes. And so I was really adamant about answering that question right up front. So we don't have to continue to talk about that. People will speculate. Did you have a, Mark, did you have a comment?
I was just going to say in this country.
In this, oh, yes. Yes, I bet you there are. There's some even more than that. I think even. Good point. And so I wanted to talk about those. So a couple of the options that moved forward were this concept called a quadrant interchange, and it's really difficult to see. But in this particular case, 371 would go over 210, and then 210, people would have to take left turns on to go north on 371, and then also even south. So it's a unique concept I had never seen before, and again, it would take a whole lot more development, but it's something that's feasible and improves the safety and traffic operation of that intersection. The other one that we kind of looked at was a diamond interchange configuration. It's a pretty standard, the diamonds themselves. Think about the one in Pequot Lakes, it's a pretty simple one, and there are certainly others around. This concept would, 371 again, would go over, and then also, you can't see it on here, it's called a Diverging diamond interchange. Now if you've been to the interchange where Hennon's Furniture is in St. Cloud, you kind of come up to the ramp, you're kind of facing each other, and then you go on the opposite side of the road even. That one has proven to be much safer than even the regular diamond interchanges and things like that. So the big takeaway is a diamond interchange, and whether how the ramp ends or how people get and navigate that is certainly open. But these are the two concepts that we thought were feasible, and it kind of, I want to say, proved or gave us the confidence that there is something out there that we can go after and develop further and see if our elected officials, both at the state and federal level, will agree to fund the next step, which is that deep dive. And so that's why we developed this one-page thing. I don't know that any elected officials are going to read 10 pages or 20 pages of technical stuff. We wanted to boil it down to a one-pager. So when these legislators, both at the federal and state level, or even you as council people and commissioners at the county level, are competing for funds or trying to talk about this project, it would be something very simple. We just simply talking points. So the range in cost that it came up with was between 29 and 39 million for construction. That's certainly a wide range, it's certainly expensive. But the thing to point out, one of the things that I was asked at the county commission meeting is, how much do we have to pay? Well, I would expect that MnDOT pays that. We're getting the ball rolling down the hill, and MnDOT should pick it up and move it, and then find the funding for it, and we can help with that too. But they're probably Baxter, because some of these, there might be local crossings like Excelsior or some of that might need some modifications. The city might have some costs, let's say the county, because we don't have any crossings. But the vast majority, these are two MnDOT roads. I'm going through it pretty fast, but I want to just be respectful of your time. I wanted to just report that we, the $5,000 that you invested, this is what it produced. And I think Brad has already been talking with some of elected officials at the state level, even at the federal level maybe, to some degree, and kind of letting them know that this is out there. I think we've both been approached over the last few years from federal people in Congress about local projects. And we just weren't ready, but now we are, to at least to be able to talk about this and ask them to please support us. Like I said, I went through a pretty high level. I think you've read the report, or you have it available. It's actually posted on our website too. Brad, did I miss anything?
No, I think it's a good summary. Obviously, we wanted to identify that there is the opportunity to do improvements to the intersection that would be of benefit to MnDOT as well as the local economy. And that was one of the biggest fears going into this, is how are we going to impact the access onto the businesses. And this is illustrating that it is potentially plausible to minimize the impact of having to do something at Excelsior where we'd have to still go over or close that intersection. This is indicating that it, at the high level, the 50,000 foot level, that there is options here or potential options here that would minimize or negate that concern or fear. The other thing I would add is that with the completion of this, moving forward, I see this as a tool that we can utilize to seek the funds that Mr. Bray had indicated that have been earmarked at federal and state levels to do improvements. Already been in contact with our state legislators and our House representatives, our congressman, in regards to his staff, in regards to this, so that we can get in the queue for grant dollars or funds to get this to the next phase, which is getting, as referenced in the one pager, to do preliminary design, community engagement, and environmental reviews completed, so that at the end of that phase, we can determine, is it physically possible, is it financially possible, and then getting it in the queue for funding for construction.
Right, what was it, 2018, I think, the program that you may all have heard of is the Corridors of Congress. And actually, this intersection was identified and brought forward by MnDOT as a project developed by their consultant to see how it competes around the state for these limited dollars. And at that time, we didn't have any of this. We didn't have any idea what was possible. We just were kind of spitballing, and we didn't have drawings, didn't have anything really, but we put it in an application. And although it still was fairly competitive from what I hear, and actually you can see the scoring on the website, is one thing that we couldn't do is tell the Chamber of Commerce the potential impacts on businesses. And I remember going and asking for a letter of support, and just because we couldn't show them the details, they had a hard time, or they were reluctant doing that. I think, although it does show some possible impact to businesses, we can be very transparent about at this 50,000 foot level that it could impact businesses or access to businesses. And Brad and I are scheduled actually on August 8th, I believe it is, to go to the Chamber of Commerce again with this under our arm to talk to them about this and see if they would be willing to support the next round of Corridors of Commerce, which we believe will start later next month. So our timing is right to kind of set up for that next round, and I think with this and support possibly from the Chamber of Commerce, we'll do much better at being able to kind of go towards that $39 million grant.
The possibility of maybe some bonding dollars too, besides federal grants and federal state highway grants or whatever too. So
Absolutely.
state bonding money would be another possibility.
Absolutely. The sky is the limit. There's a lot of things out there that we just have not been situated well for. I think something different than what MnDOT employees don't lobby their bosses at the legislature for funds, but we can do these efforts and raise awareness to them, and that's what we're approaching.
In summary, I think it's just, we need to educate that there are some, everybody up to this point was saying something needs to be done, we didn't know what that meant, now we know what it means. Now we can start asking for support, like the Chamber of Commerce for letters of support. We'll continue to build on that, build a booklet of letter support, so that when we continue to have conversations with our state legislators or federal legislators, that or when
So MinDOT was involved as a financial partner, and actually they reviewed this, but the analysis really was done by another consultant. And the budget did not allow us to dive into future plans and even how these two studies that I talked about will interact with each other. We're really focused on, what could fit there and some of the higher level traffic stuff. So, Mr. Mayor,
I don't want to get off track, I was just trying to figure out, I can't understand that period, but anyway. Anything else? Well, thank you very much for
thank you for having me.
sharing with us. Second item, Mr. Ward.
Thank you, Mayor, council, staff. I had asked for 30 minutes, and I'm obviously not going to do stuff that the council would listen to that. So I'm going to start the timer at 25 here, and I will finish at 25, and I'll be having some extension at the end of this. So I'm just going to start and go. My plan for tonight's discussion was 30 minutes, it'll be now 25, but
We can adjourn and come back.
I'm going to give you a narration, a synopsis about essential healthcare services. Will be no more time to discuss this. I encourage all of us to take some notes and ask questions and, and have further discussion. But tonight I just want to give you a narrative. I've done a lot of research over the years. I've gotten a number of constituents come to me, both with Essentia, without Essentia, etc. So I've got 30 minutes here. Let's look at it. So I'm just going to go. I want to be very clear. This is about essential healthcare services and no other healthcare provider. It's also not about our healthcare essential employees. If you've been involved with healthcare essential employees, they are heroes who are overworked, stressed, and do a good job. It is not also about our local St. Joe's Advisory Board, who also gives and gives and gives and does a great job. Clearly, not essential healthcare employees, not essential St. Joe's Advisory Board. This is about communication and a relationship with Duluth management out of Duluth. I know you all know that I was born in Proctor. I was born at St. Mary's Hospital in Duluth, which I know Connie knows well as also, and used essential healthcare up there for 37 years. I've been down here for about 37 years, and I've used the essential healthcare down here for about 37 years. The healthcare services that I'm gonna address, and since I started taking notes in 2014, going back to 2014, has significantly in the last 2 years been depleted, eliminated, moved, shifted to Duluth, cut, staff let go, and losing our local decision-making autonomy. We used to be our own local decision-making autonomy through St. Joe's Advisory Board here. Basically, that's gone. It's all been shifted to Duluth. Duluth is also building a two block brand new medical facility, where this autonomy, this Baxter, Brainerd, Lakes area autonomy healthcare system has been financially solvent, done well, provided services, expanded services, looked at new services, and has now been asked to shift more and more money back to Duluth, and taking away local autonomy, local decision making. That's what this is about. And Mayor, you addressed the question last meeting, and I'm going to address that if I get to it. If I don't tonight, I will vet it in the future if you allow me to. And your question was, well, what can we do locally? I'm going to talk about that.
Okay.
Our local autonomy has now been moved to Duluth, who is directing most everything. Our local medical facility was provided fast, great services, we're able to invest back to our own community with quality services, expanded services, quality facilities, expanded facilities. Now has been asked financially to subsidize a Duluth project. So, as I indicated, I have viewed both facilities. I have done my homework. I have done my research. And I have had discussions both with St. Joe's Advisory Board members, a gentleman by the name of Dr. John Pryor. Dr. John Pryor is one of the CEOs in management up at Duluth. Dr. John Pryor and I have had a number of conversations both prior to me being elected and post being elected. We have had good discussion because as I have found out through participating in local healthcare services, more so in the last year than I care to talk about, I came to fruition, it came to my realization that things have changed around here. Sometimes in my discussion with Dr. Pryor, rather than I feel quite honest and frank and right up front, I hear different sides of every story. And that's true with everything. You know, our spouses hear some stories differently than we hear sometimes, you know. So, I'm not surprised by that, but what I am surprised of is sometimes the stories are 180 degrees apart, and that's concerning to me. As I said, I've also talked to our local St. Joe's Advisory Board and have appreciated their input and their discussion back with me. I bring this up because I have heard from many local constituents that are greatly impacted by services, impacted on what has happened with them, with others in their family, with the relationship with Duluth. And it is my opinion, it is incumbent on us as elected Baxter city officials to address important issues like 371 and 210, like expanded broadband, like ATV problems, like well problems, like special event problems, like name it. Name it. It's incumbent on us as elected officials. And I know that it is important to have effective and efficient meetings. I know that, I get it, I've served on a local municipality, state municipality, I get it. However, I'm not willing to give up a good, thorough dialogue and discussion and a plan to talk about a loss of health care. Now, maybe some of you and your family have been excuse me, have had healthcare facilities locally impacted your family as well. But I don't care what the topic is. If we feel strong enough, if we as elected officials and staff feel strong enough, then it is our duty and our responsibility to address those and see if there is anything that we can do. I don't know if there is, but in my opinion, it's our responsibility to discuss it and see what can be done. So that's why I'm bringing it forward. Let's see, let's discuss, let's talk, let's ask questions, let's seek a solution. Let's see what we can do. I was recently at a non-essential health medical facility, been at a lot of them, right here in Brainerd, getting healthcare services for a different part of my body. And the medical doctor that I was seeing, he was discussing local healthcare with me. I never brought up this discussion. He was just discussing it with me, and he had been through some personal family issues that couldn't be handled locally, and so he started checking things out. And in his own words, well, you know, John, everything's been moved to Duluth, quote, unquote. And that struck me. That struck me. Because here's a healthcare provider who had family issues, and he delved into it a little more, and that's concerning to him and his family as well. So let me talk to you about did I say 1984? I've been taking notes since 2013, 14 on medical stuff, because that's when I started going through some pretty serious medical things at that point. So let me talk about services that people have come to me and talked to me about, or I have heard about, or just from constituents or whomever. We talk about the departments and the medical services that I've witnessed being cut. Cardiology. And I want to give you some personal examples of this, of not just me, most of these are other personal stories. Pathology. Let me stop right there just for a minute, because I want to share a story about this. Pathology, to me, is significant. When you're on a table and you have a serious health issue, and let's just say it's breast cancer, and you have to have clear margins, or it's throat cancer, or it's esophageal cancer, or it's name it. And you have to be on that table and find out right now, do they have a clear margin? Do they have a clear margin to know what treatment you're going to receive that could be life-saving? You can't wait for that pathology report to be sent to Duluth. You're on that table now. And my wife went through that, and I know others sitting at this table have gone through that. Food services. And again, God bless those essential health employees and St. Joe's employees. I just got to the hospital recently. I'm going back to the department. I'm not going to tell personal stories right now. Mental health, psychiatry, emergency room, local administration. Dr. Adam Reese, Mr. Tom Pruzak. Local autonomy, local decision-making, local people in charge of our local health care. House cleaning, nursing, endocrinology, PTOT, specialized wound care. And there are others. And again, a lot of this is not from me. Some of it, but not a lot of it. Most of it is from others. And let me just talk about a few personal stories. I might even get into 30 minutes or 25. 2014, 13 and 14, St. Joe's Hospital just had built a brand new, beautiful healthcare facility. Cardiology facility. They put millions of dollars into it. They contracted with Centricare out of St. Cloud for the cardiology. They had a really good relationship for a number of years. Centricare doctors were coming here. Centricare cardiologists were coming here. They're doing a great job. This is a personal story, and I'm going to share it. In 2014, when I was still in St. Paul, I needed to have 2 stents put in. I came to St. Joe's. I had a cardiologist by the name of Dr. Wade Schmidt out of Centricare in St. Cloud. He was one of the cardiologists coming from St. Cloud that was doing great work in the brand new $1 million cardiology facility that we built in this community. Got my stents in, did great. I had a follow-up appointment, it was either the next day, person to get stents in St. Joe's Hospital. And from a central care doctor, from a cardiologist, that they had cut their contract with Duluth Essential. I said, what do I do? What do I do? Well, we've got another a person, not a cardiologist, not at all a cardiologist, but another person. And I said, well, where did Dr. Schmidt go? He's in St. Cloud. So that's where I went. That's where I went. I've been with Dr. Schmidt ever since. Now Central Care has a beautiful facility here, thank God, in Baxter. And proud of it, and they do a great job. Pathology. I just talked a little bit about the need for the pathology being done. I was told in one of my discussions with management up in Duluth that was made, the request was made to move pathology by the local pathologist. I later found out the local pathologist needed help because he was overworked. Does that sound familiar, Mayor? And Duluth said, no, we can't get you any help. You know what that guy did? He left. Somebody recently had a great need for specialized wound care. They were shocked that they couldn't find people to take care of the specialized wound care here. They were shipped to Staples. I'm sorry, they were shipped to Clean Range. Procedure to help another person in our community with breathing issues. The expertise wasn't here, used to be, but wasn't here for that local person to have that expertise done again because it was shifted out of here. That person ended up going to Staples. Psychology and mental health. Most of my career was dealing in mental health and emotional behavior disorder students, special needs students. Who I really liked, by the way. We got along with maybe a little bit of them in me, you know. But I know how important mental health services are. We all know that. We all know that this is not just a local problem. Mr. Mayor, council staff, residents, it's a huge nation problem. Nation problem. And there's all kinds of aspects about national health right now, mental health needs, including, in my opinion, mass shootings. So what's happened with that, with our local psychiatry, mental health services? Let me tell you. And this was from somebody else that's a Baxter resident. That served as a mental health practitioner and a psychiatric practitioner, and had a very successful rate in dealing with psychiatry and mental health. When the state came in, Department of Health and hospital evaluations, and it's not unlike any other practice or business. They get evaluated. State came in and evaluated Brainerd's mental health department and psychiatry department. And my friends, you know what they got? They got an A rating. They were top shelf. Duluth started sending back to our people, you're not following our proper policies and procedures, and we want you to follow our guidelines, even though Duluth's mental health department, the psychiatry department, failed in their evaluation. They insisted that we do it their way. Their way. When our practitioners were helping people big time in a way that was very, very appropriate. And I understand there's always two sides of every story. I understand that, I get it. And the more I check into it, the more concerned it became. That practitioner left, is now doing really good work elsewhere. And I feel so sorry for those that need mental health psychiatry needs, not only locally, but nationwide. The management, our local autonomy, decision-making, and our management. We had, as I mentioned, Tom Pruzak, we had Dr. Reese. In my opinion, they did remarkable work here. I was told that, you know, they were both looking towards retirement and leaving. The more I investigated that, the more I felt that they were pretty much pushed out. And again, these are my words, these are my opinion, based on my research. And I would encourage all of you to do some asking of questions and research as well. Another constituent just recently came to me after spending 4 hours in the emergency room, needing to be hospitalized, and spent 4 hours waiting to get a room. Was told there were no rooms. Got to the floor, there were lots of rooms open. There was not enough staff to take care of the emergency room and to get that person up to this floor. That's wrong. That's wrong. Nobody should have this. And during that time, I guess, you know, that poor staff got hollered at, sworn at, screamed at, named it. Name it. That's not right.
Can I ask you to put your thumb in your page right there, and we'll come right back to that, and you can mark your spot. And we'll, I think we pay these engineers by the hour, so we want to get them out of here.
I didn't realize you were here for the
For the council.
work session. Okay.
Well, they are.
All right.
They're